Hi, I'm Dr. Rohit Madhurkar, Consultant Interventional Radiologist at Pinhole Clinic and Apollo Hospitals, Bangalore. This is a very common question that I get from my patients. Can I just take some tablets, apply ointment without any procedures or anything? Can I get my varicose veins cured? The answer is very clear. It is no. I'll tell you why. I'll give you a very simple example. Now imagine if I have a fracture, what will happen? The bone is broken. If I apply any ointment or take a tablet, the bone is not going to become straight. You have to plaster it, put a bandage or whatever, and let the bone heal in that fashion. Then only the bone is going to heal. The meaning, what I'm trying to say here is, this is a structural abnormality. So when I mean a structural abnormality, here this vein which was normal has become tortuous, bulged, the valves have got spoiled, it is not functioning like how it's supposed to function. Now by putting any medicine or applying anything or taking oral tablets, say let it be allopathic, naturopathy, ayurvedic, any forms. I hear different forms of treatment like leech therapy, they do some banding, some special massage and all that. None of these are going to make this vein straight and normal. The principle behind, let me tell you again, the principle behind treating varicose veins which are significant and causing trouble to the patient is to close this vein. In earlier days, when conventional surgeries were done, it was called as stripping, wherein they go into this vein and they strip the vein out. The subnormal vein was pulled out or ligated. So ligated in the sense they close it off. This was the way that was treated before. Now with advanced technology, we have methods wherein we make a small pinhole, enter into the vein and seal this vein in different forms, either with laser, ablation, or use a super glue which will seal this vein, and we come out and the blood will not flow in this abnormal vein and the symptoms will recover. But what is most important is not to unnecessarily spend time on taking medications. These medications are just going to be of temporary symptomatic relief. They are not going to give you cure from varicose veins. The message I'm trying to say here is, if you are looking for a cure from varicose veins, it is not the medicines or any application that you can do. So conservative ways say that we don't want to go for a surgery or a procedure. So there are only two things that you can do to make this happen, not to get troubled with varicose veins. One is a prevention. Try to prevent varicose veins. Second thing is, if you already have varicose veins, then stockings, wearing those socks, I know, which is very cumbersome for everyone. Even I have varicose veins. It is very cumbersome for us to put it on, get to the work, come back. When we put it on, we feel very good, but putting it and removing it is a more bigger concern. In varicose veins treatment, these veins, after it is sealed, what happens? Everybody is worried. You are closing down the vein, then where will the blood flow? This is like the most commonest question I think I can get from any patient when after I explain how we treat. It is very simple. Once the main road is closed, all the traffic gets diverted to the side roads. There will be many veins in our body which are small, which are not mature enough to take all the bloods. They all start flowing into the other veins which have normal structure, normal valves. Over time, these side roads become main roads, and that's how it supports the leg. So this is how we treat varicose veins. And to put it in nutshell, tablets or medications are just for symptomatic treatment, or any form of application. They're all just for symptomatic treatment. They do not cure varicose veins. Thank you.